Self-love is very important.
Okay.
So I got my release from all that when I started to, when I learned to say no.
Right.
You should learn that also. You should respect that. People should respect your time, and you should also love yourself so much that you should give some time for yourself every day.
Right.
And for a normal patient who is in labor, you need not think about all the complications before they happen.
Right.
Understood? So that way,
Always think positive.
yeah, thinking positive has a great benefit for our mental health.
Right. Can you describe your team? Who all is part of your team? What are your teammates? What do they do? Just a small idea.
Yeah, I have a very good friend, a gynecologist, Dr. Sajita. She joined, both joined hands in 2012 when I was in Elite. See, I joined Metropolitan, and after 9 years, there was a strike all over Kerala, nurses strike, and the labor room had to be shut down for 2 months in Metro. So I had to shift to the
Another
next
hospital.
just nearby, Elite Hospital. But then I stayed there for 5 years, and that 5 years I got a lot of other exposures. Like I got a new friend, Sajita. She was working there
Right.
at that time. Then we both started working together. She's also working in another hospital.
Okay.
So she is not full time here, but whenever I need her, like she always covers up for me, like today.
Right. Okay.
And then I have a physician assistant, Jilsha. She is also very good, and she does all the writing part, all the history taking, so many things, discharge summaries, everything, and she knows
Taking your
everything
appointments.
well. Yeah, taking appointments. We have another person also.
Okay.
But and then she replies to the queries, patients' queries. See, I was so stressed out in the beginning, because even though I had only a few patients, there were so many phone calls coming at odd times. People would request to see. Like people will come to the casualty at odd times, and I was never I always had this fear that I would miss out something. So I always used to go and attend to these cases,
Right.
whatever time of the day or night they came.
Right.
So that took a huge toll on me, in the sense that I was always, when is the next call going to come? So I got my release from all that when I started to, when I learned to say no.
Right.
You should learn that also. You should respect that. People should respect your time, and you should also love yourself so much that you should give some time for yourself every day.
Right.
So now I take only what I can bite, not
Right.
more than that.
So what we have learned from this is, one, we should have a good team,
Yeah, that's
a
important.
trustworthy team,
Team.
a good communication,
Yeah.
and self-love.
Self-love is very important.
Okay. Because I think people never value our time.
Yeah.
We are always taken for granted, and we always need to be available for them. But there are times when people don't realize that we are also human.
Yeah. No, the thing is, if we don't take time for ourselves, our care for them will suffer.
Correct.
In the end.
Right.
And,
And not only for them, I think little bit of your personal life.
family will suffer. Family will suffer.
Right.
Everything is not roses for me, though it may seem like that when I talk to you. But it was very difficult in between, maybe between 2006 and 2014, that time, 14-15. That time when my children were growing up, they were in the school, I had to look after their studies, their projects, all sorts of projects they'll bring home.
Right.
And then and children are children always.
Right.
It will be difficult to manage in between. So all this, and in addition, I used to be so tensed. Even if there is only one patient in the labor room, till that patient delivers, there will be something burning inside me.
Right.
What complications? I used to think about all the complications that can occur. That is how you are trained to.
Correct.
In your curriculum. Actually,
Right.
you are training these students to look at the complications first. And that takes a heavy toll on your mental health and your physical health also. It is when I started meditation and yoga and learning that personal growth program about in 2014, I think. From then onwards, I felt this shift inside me, where I would not think of all the complications all the time. you need not think of that. That comes only once in a while.
Right.
And for a normal patient who is in labor, you need not think about all the complications before they happen.
Right.
Understood. So that way,
Always think positive.
yeah, thinking positive has a great benefit for our mental health.
Right. So now you are an established consultant at a private hospital. What we normally encounter is we have multiple consultants in and around the working hospital. Have you ever felt there is a lot of peer pressure, or have you ever felt that now if a patient comes to me, he may go to someone else for opinion, will I lose that patient? Was there always a concern, or did you have any peer pressure?
Actually, I didn't feel that, probably because when I started working, I was the youngest one in my hospital.
Okay.
There was Rajagopalan sir, he's very much senior to me, and he was a great support to me.
Okay.
And Vishalakshmi madam, she was not well that time, but still she was a support. And then Shankaran sir, he is also so much senior to me, and whenever I had any problem, I could call any of these. They were all ready to help.
Right.
So I didn't feel any peer pressure in that sense. And also I felt that in Thrissur, the Gynaec Society, we have a Gynaec Society which is so friendly area, and we had all this interactions in all our monthly meetings, and Serena madam, people like Serena madam, Paili sir, Vasanthi madam, all these people are very like helpful. Approachable, helpful. So we had this close ties between all these. So I never felt this peer pressure or anything. In fact, they all have helped me in different ways whenever I have had a problem.
Okay. Any complication in now you have become a consultant, you feel that no, things will be so smooth, I am a consultant.
No, I never felt like that.
You never felt like that. So do you remember anything, you mentioned one complication in your DNB days, anything which you remember during as your consultant?
In my earlier days as a consultant, I had this one patient, I had a maternal death. That is the nightmare of all the gynecologists. So this patient, she had come.
Maternal death meaning mother?
Maternal death means a mother dies during delivery or during pregnancy, that is maternal death. This patient had come with leaking, that is fluid break. She had come in the early morning. At 8 o'clock I came for rounds. I saw her in the labor room, did a PV, and she was progressing. So I asked her to walk outside. But first I asked the sister to take a CTG. CTG is like ECG, the baby's heart rate. So take a tracing and then send her out to walk. At that time I went for the rounds then. And during my rounds, a call from the labor room came and asked me to go immediately to the labor room. So when I reached the labor room, I found that the baby's heart rate was dropping and the mother was like, she was not responding. So I immediately I asked them to call the anesthetist. So he was there in the theatre attending to some other case. So he came immediately. He said the patient is hypoxic. Put in he intubated her there itself.
Had to be put on a ventilator.
The boils had to be brought to the labor room and we intubated her, but she passed away. So that was a great shock to me. So it was a pulmonary embolism. We took an X-ray immediately. It was a pulmonary embolism, amniotic fluid embolism actually.
Yeah, can you describe a bit more what exactly?
Yeah, sometimes what happens is this amniotic fluid gets into the blood vessels, into the arteries or the veins, and it goes to the lungs where it blocks the pulmonary arteries and causes a drop in the oxygen levels of the patient, and if the patient doesn't get oxygen, she can't live. So that is what happened, and we tried resuscitation, but she couldn't be saved. And all this took place in about 15 to 20 minutes. It was all the fortunate thing was at that time I was in the hospital, the anesthetist was there, so we could do everything possible to save her, but still we couldn't save her. But then at that point of time, suddenly all this training from my mentors, especially Serena madam, helped me a lot, because whenever there is a problem, she always goes and talks to the relatives first and I always see how she speaks and also. At that moment when she collapsed and I called the anesthetist, I went out immediately to the bystanders and told them there is a problem there. She has collapsed. We are trying our best to revive. I brought them in, the husband and the brother.
Right.
Not husband, brother and father, I think. They came in, they saw all the resuscitation being done. So all these small things which I learned from my mentor
Your
helped.
soft
skills. That helped a lot because they understood there was no problem. But look at the cases now. So many cases are all around Kerala where people are turning violent against doctors and so I am not saying that it's my that communication skills that saved me. It's because the people are also like that. They were very good people.
We all know that definitely whenever such a complication happens, the patient's family, near and dear ones do get affected. But how does that incident affect you as an individual?
See, after all these years, it was around 20 years back. 20 or maybe 18, 17 or 18 years back. Till now, this is fresh in my mind. You can imagine what I went through in the 1 month after that, without anybody blaming me or without any problems whatsoever. I couldn't sleep for days altogether. I was thinking of this patient every day, every second. I was thinking of her for months altogether. I couldn't sleep for some days. So even without any problems coming out from there, that was my situation. So just imagine if everybody around you blames you and turns violent against you, what will that, how will that affect you?
Because to what I have understood or whatever I see, it is not easy to build a practice. But just one incident can spoil your practice, can spoil your motivation. You will not be motivated to practice again.
True.
You will be scared. How will I ever encounter one more complication?
True.
So I think it is very important that our viewers or our public understand that we are only facilitators. We can help, but we are not completely responsible for anything and everything happens. As a medical professional or as a doctor, we only expect good for the patient.
Good for the patient. We always do whatever is the best for the patient.
Best required. But sometimes due to fate, bad luck, things may not go the way we want.
True.
So it's very important that we need to keep cool, we need to keep calm, and communication, written as well as oral communication, has to be very important in having a safe practice.
Oral communication is quite important, more important than written, I would say. Written is important for medico-legal purposes, but the oral is what keeps you in sync with the patient and the relatives. We always have to tell them everything.
Do you explain complications to your patient, or do you only tell the good part?
See, the written consent actually gives all the complications for a hysterectomy, from bowel, bladder injury, death, everything they write. But if we go and tell the patient everything that you may die from this operation, see, they will be scared like hell. And that stress itself will hamper their healing. I've always found that in my obstetric patients. See, earlier on, when a patient was not progressing as I would wish her to, I got tensed, and naturally my tension would be revealed to them in different ways, by our expressions and by the way we talk. We won't be cool, and we may tell the bystanders also, see, if she doesn't progress, I may have to do a cesarean after so many hours or so, and she's not progressing. That way, when you talk that way to the patient or the bystanders, they will all get tensed up, and that tension in the pregnant women or the delivering woman itself will hamper her progress. It is well known that fear tension will lead to decreased dilatation of the cervix. It will cause fetal heart rate abnormalities, that is, fetal heart rate may drop because the oxygen content in her blood will drop, because all her muscles are tensing, all the adrenaline and all hormones, stress hormones are coming out. So we should always be like, and I am telling you, it has made a huge difference in my practice, and the levels of stress that I have directly affects the patient. And
Because patient comes to you with a certain trust, we need to show them confidence. We need to show them that we are capable of looking after you. So we as a person first need to be calm. Yeah. So we have learned about your ups and downs, the struggles you have gone through. Let's go to a little bit on a lighter note. Let's find out what are your current hobbies? How do you keep yourself engaged? Do you have any extracurricular activities, any passions, hobbies? How do you spend your time apart from the hospital?
Usually I begin my day with a short meditation, then a little bit of work at home,
Right.
followed by half an hour of yoga, and then I go to hospital at around 9 o'clock, 8:30, 9 I go to hospital. I come back by around 4 o'clock. I have my lunch after coming back.
Okay.
And then I go for my gardening. I have a vegetable garden.
Okay.
I started it during Corona times, and then I am continuing it now. I am getting around 1 to 2 kg of vegetables per day.
So your home vegetable is
self-sufficient.
Self-sufficient. That's nice.
Except for onions and garlic and such things.
Okay.
We have.
So is your happy moment at the garden?
Yeah, because gardening is not only for the pleasure part, but we have to. I have learned that interacting with nature is a very important part to maintain your health.
Okay.
Your microbiome gets enriched.
I see. Okay.
I am particularly very passionate about learning about the microbiome.
Okay. Can you explain what is microbiome?
Microbiome is the community of microbial organisms living inside your body.
Okay.
It is said that we have around 30 trillion cells in our body, human cells, and about 39 trillion microbial cells, that is bacteria, viruses, fungi all together.
Right.
So these 39 trillion bacterial cells are actually providing you with much of the nutrients that you need.
Right.
Whatever you are eating, it is broken down by these microbes into other compounds which you can utilize. Otherwise, you won't get those compounds.
Right.
So the health of that microbial organisms is very important. Present day, because our food is adulterated, water is not clean, you are not breathing good air, you are not exercising, you are stressed out, your food is all junk food you are taking in. All this is leading to a great imbalance in your bodies.
Okay. How much time? I mean, you mentioned you meditate.
Yeah.
How long do you meditate?
15 minutes. 15 minutes most days. Unless I have a free day and Sundays and all, I may do longer. Otherwise, 10 to 15 minutes. That's all.
That has brought in a lot of change.
A lot of change. I can feel it when I am not meditating. For some reason, if I am not able to meditate for 1 week or so, I can feel it in my inner the thought processes. I get more tensed easily. I can feel it very well.
There is a trend that if you to be called a busy doctor, if you are there from 7 in the morning to 7 in the night, society labels you as he's a busy guy or he's a busy lady doctor. Does that hold value or does it hamper you?
It hampers your growth as a person. It hampers your health, everything. See, I told you earlier that when I learn to say no, I have more peace. And by that, what I mean is, I come back at 4 o'clock. Somebody may be needing to see you. Some patients may want to see you in that more than what I have time for. So I say, you book and come another day, because if I start seeing patients like that and I come home every day late, I won't be able to do my gardening. I won't be able to give time for myself. So I always respect my. I want everybody to respect my time.
Right. Respect you as an individual. Respect your time.
Yeah.
Respect your family, because ultimately we also have a life.
Yeah. And that matters, because that will affect the quality of care you give to your patients. If I am tired and I am irritated, that will reflect in your care also.
Right. Something very common seen in our current life scenario is something everyone talks about is infertility, which is on the rise.
Yeah.
As a gynecologist, what do you feel could be the reasons of such a rise of infertility among couples?
What couldn't be the reason? അതാണ് ഞാൻ ചോദിക്കുന്നത്. That is because see, our diets are all changed a lot. Our stress levels are skyrocketing. Every person is having, and the relationships are spoiling. Family relationships between extended family members, all these causes a lot of stress in our lives. Then all the other lifestyle habits like sleep is completely disturbed nowadays. Even those who do not have a night shift, they sit till 1 o'clock, 2 o'clock watching TVs or the mobile, then sleep at 2 o'clock or 3 o'clock, get up at 10 o'clock. Persons who don't have other jobs.
Right.
Those who have jobs may have night shifts. They may have a 9 to 7 job, after which they have to come back and do all the work at home, and they are sleeping late. They are not refreshed in the morning because not sleeping enough. And all these things are taking a toll on the people. And obesity is on the rise. And most of the infertile patients, they also have this obesity aspect also. PCOD is on the rise. So all these things are causing, the body is not ready to conceive.
Okay.
See, that is the nature's way of telling, I am not ready.
Okay. So this could be a natural way.
Natural way that the pregnancy is prevented by the nature. Because if pregnancy occurs when we are not having the optimal health, what happens is the baby suffers. There are epigenetic changes, that is these certain genes can turn off or on depending on our lifestyle. So if you have diabetes genes which you inherited from your parents, you are not diabetic at birth. You get diabetes when you are 30, 40, 50 depending on how you live your life.
Right.
And when your life is not at its optimal best, then these genes turn on. And when you conceive in that state of health, you are giving your children the
next generation
these turned on genes of diabetes and other diseases. All the chronic diseases have their root cause is lifestyle.
So we to our viewers, we must ensure that they all consider a healthy lifestyle.
Yes, that
a
is
good
very
sleep,
important.
a good sleep,
Yeah.
and at least some form of extracurricular activity or exercise to keep them healthy.
Be physically active.
Be physically
Especially
active.
in pregnancy also. See, pregnancy, everybody thinks that, oh, she is pregnant, let her take rest. Mother-in-laws and mothers alike, nowadays, they don't allow their pregnant women to work out or even do any basic work. So what happens is sedentary habits will affect your children in a very negative way. Even brain development is dependent on physical activity of the mother.
Okay.
So all these are new research is coming out every day about all these aspects.
How important is when a woman is pregnant, talking to the fetus or the baby inside?
Yeah, that is very important. See, I realized this when I initially, many of my patients who were in Gulf, when they came for their second delivery, the elder child will be with them,
Right.
4 or 5-year-old. And I used to talk to these children when they came. So I found that many children are not, and so that mother said, no, he is late in speaking, he has not started speaking yet at 3 years and all, he speaks only a few words. So then I read in a book that language development begins in the womb, and especially in the younger days, there are studies from Harvard which shows that the more you talk to the child from the womb to the initial few years of life, the more you talk to the baby, it learns that language.
Right.
And see, these children are often kept under the care of a caregiver or a daycare center,
Right.
where the language will be different. These people are coming from Gulf and other countries. The caregiver has a different language, so they are not spoken to in their native language. And at home also, their parents are tired when they come back. They don't have much time to interact with the baby.
children,
So that all leads to a decrease in the language skills and development of the baby as a whole.
Okay.
See, 15 to 20 years back, 22 years back when I started my practice, if a 100 kg patient came to me pregnant, I would have I would have thought, how am I going to deliver this patient? But now it is common. 80, 90, hundreds are common. And we all know that COVID has affected these patients with comorbid conditions more.
Right.
So, in the same way, when pregnant patients are coming with gestational diabetes or hypertension and obesity, all this, they are not normal.
Right.
They are not completely healthy. So, you can expect more complications in the coming years.
I completely echo with you, madam. Now, as you mentioned, yes, complications are on the rise, maybe due to lifestyle. Diabetes is very seen at a very young age.
Yeah.
So, whenever since I focus more into spine-related work, whenever if we end up with patients ending up with infections, we sometimes feel that it is sometimes our mistake.
Yeah.
Or something within the hospital, but sometimes it can be inherent from the patient's point
True,
of view.
that is very true. That is very true. When
So-
you are not normal, when the inflammation levels are high in your body, you are prone to get infections.
So I think we must counsel our patients about how to tackle obesity, how to focus into more of a healthier living rather than focusing more on bad diet, no exercise, being very sedentary. So these points I think every doctor should try to focus counseling the patient
It's very important.
on these points also to prevent complications at a future rate.
Yeah, true. It's very important.
We have heard behind every successful man there is a woman. But in your case, or I think in the field of gynecology, behind every successful gynecologist should be an understanding partner. What do you have to say about your life partner?
100% true. Because my husband is also, along being a pulmonologist, a practitioner himself, he is also on duty with me. When I have a call at night, he comes to open the gates for me. When I return from hospital, when I get into the car, I call him again. He opens the gates and waits for me there.
His sleep is also
his sleep is also as much disturbed as mine is.
Right.
So because he is so supporting, I can
Understanding.
understanding. I am able to do the work I want to do in a way that satisfies me. Otherwise, see, if we don't have that support at home, if we have to either stay in the hospital or you have to finish off your work before night.
Right.
So that either way it becomes it's not satisfying.
Right. So I think an understanding between husband and wife
It's very
that
important,
both
very
professions are important.
Yeah.
Respecting each other's space is very important to
And
have.
helping out.
And helping out. That only will in turn help our practice and give a better care to our patients. Okay. So after a very informative session, we have finally come to the end of our episode. Can you give us few pointers we have a lot of MBBS aspirants as our viewers. What should they look at or what should be their approach to choose gynecology as a profession?
I don't think students nowadays want to take up gynecology because of the inherent risks that they perceive in gynecology and obstetrics. But I must tell you that this is also the most satisfying specialty.
Okay.
See, though you have so many risks, so many problems, complications that can occur during labor and delivery, the minute the baby is born normally or otherwise, everybody is happy.
Right.
That's not the same case with the other specialties. Whatever you do, still, especially with the chronic illnesses.
Right. It is a celebration in the theatre.
It's a celebration. It is a celebration, and you are also a part of that celebration. And you
because I have always seen whenever a baby is delivered, the parents deliver or give cakes to the theatre, to the ward, to the nurses in the ward, though they have not actually delivered the child. So it's a big celebration, as you said.
And beware of these cakes. Too many sweets can make you fat. I was fat once upon a time and I stopped eating all that.
Right.
Okay. So the thing I want to say is, if you build up your practice in such a way, if you are not working in a big hospital where all the patients are coming for the hospital, not for the doctor.
Right.
In that case, maybe I feel that I wouldn't be as satisfied as I am now, because you have these long term patients now, the second generation of like those mothers whom I delivered, their daughters are coming pregnant with me, to me.
Great.
So that is a great happiness for me, and I feel so happy to see these people coming back, and it's very satisfying. But the thing is, you must be patient. Rome was not built in a day.
Right.
And it's only with 23 years that I have built my practice to this level, so that I am free somewhat, because I can now dictate my terms,
Right.
like when I want to work. Not that any patient I have already seen, she is under my care, whatever time they come, I have to attend to her. But new patients, I have the freedom to decide. And you should keep some time for yourself. That is what I tell all the doctors, because being stressed and strained out ourselves will take a toll on our patients and our family and ourselves and our own health.
What about
So,
exercise and lifestyle for doctors?
I think recently as the statistics came out, no, that Kerala doctors die at an earlier age than the normal population.
Okay.
Because we are not taking care of ourselves. We are just telling our patients, but we are not carrying it out.
We are not
So,
acting.
Yeah, what
We are
you
not
preach, you should
Yeah, we are not practicing what we are preaching.
So, I feel that gynecology is a very good option, but you should, the new MBBS aspirants who are trying to get into gynec, they should understand that whatever they are studying in medical college is not enough. They should focus more on lifestyle. They should learn more about that. There are numerous good authors, doctors, and so many books are out there which discuss different aspects of this problem, this lifestyle diseases, chronic lifestyle diseases. So, we must be aware of that. We must educate our patients, and more we educate our patients, more they will become connected with us, and they'll really look up to you.
And what do you feel about communication skill?
Communication skills, we all know now, we are all talking about these skills in the conferences and all. This is very important, and usually we tend to imitate our mentors.
Right.
We get that skills from our mentors, and if we have a good mentor, I have my role model, and she is the one I always follow.
Right. So I would like to end this show by saying that whenever my wife came to see you or consult you, she would always look at you as an angel, always smiling.
I am flattered.
Always smiling, always contented, always pleasant. So I think we must look at our patients as a family member. Treat them in such a way that this is one of our own, so that our patient feels that we are well taken care of. We need to be truthful, and we must inform them about complications, about what can happen, so that they are not in a scary way, but they must understand that anything is possible, that we are only human. We are not God, or we are not.
I beg to differ on one point, because I found that earlier on I used to follow this advice, talking about all complications. So, the minute the patient was not progressing, in labor I am telling you, in labor when a patient was not progressing, when I thought that she might have a problem later on, I used to tell her itself that maybe we may have to, after 4 hours, if you are not progressing, we may have to do a C-section.
Right.
See, that itself will lead to a C-section. I found that out in the difficult way.
Right.
So, that is actually that the mind-body connection is so much that the moment your mind believes something, it is more likely to happen. And the moment you shouldn't scare patients like that. But in the same time, I think it's better to educate your family members. If you have to talk about that, talk more to family members, and a positive approach will always will most of the time bring a positive outcome.
Okay. So with this positive note, madam, I thank you for coming to our show. It was a very informative, not only about gynecology, lifestyle, infertility. We have covered very, very important topics in this interview. So thank you for coming to our show.
And thank you, Vivek, for having me. I am really flattered. I am just an ordinary gynecologist in a small town.
Ordinary or not, it is important. It is important for us to know how to have a basic medical practice, and what our viewers, be it patients, be it common public, that we need our time, we need our space, we have a life too, but we will still sacrifice anything and everything for a betterment of the patient. So thank you, madam. Thank you for everything.
Welcome.